One of the very exciting findings in neuroscience in the past 75 years is that pleasure and pain are co-located in the brain. So the same parts of the brain that process pleasure also process pain, and they work like opposite sides of a seesaw or a balance. When we experience pleasure, that tips one way, pain, it tips the other. But there are 3 rules governing this balance. The first and most important rule is that the balance wants to remain level, so that with any deviation from that neutral position, our brains are going to work very hard to restore a level balance. And that level balance position is called homeostasis. The question then becomes, how do our brains do that? And that's really important to understand in order to understand how it goes awry as we become addicted. So imagine, in my case, I'm eating a piece of chocolate. I love chocolate. That releases dopamine reasonably quickly in my brain's reward pathway, and that balance tilts to the side of pleasure. But no sooner has that happened than my brain is going to counteract that increased dopamine transmission by downregulating dopamine transmission, for example, by involuting or pulling back on postsynaptic dopamine receptors. But the interesting thing is that my dopamine transmission returns not just to that homeostatic baseline, because we're always releasing dopamine at a kind of tonic baseline level, but actually it goes below baseline. And I like to imagine that as these neuroadaptation gremlins hopping on the pain side of the balance to bring it level again, but they like it on the balance, so they stay on until it's tilted an equal and opposite amount to the side of pain. That's the hangover, the come down, the blue Monday, or in my case, that moment of wanting a second piece of chocolate, even hypothetically while I'm still finishing the first piece of chocolate, even slightly outside of my conscious awareness. Now, if I don't have another piece of chocolate, let's say there was only one piece, then eventually those gremlins get the memo. Okay, we're not getting this exogenous source and our job is done. We can hop off the pain side of the balance and homeostasis will be restored and we'll go on our way. But as long as they are on the balance, I am likely to experience craving to ingest more of that substance or repeat that behavior, because remember, one of the overarching drives is to restore a level balance, a homeostasis. And if I can do that faster, at least in that initial exposure by ingesting more or doing the behavior again, I will probably do that, because that's a very strong physiologic drive that dominates much of living organisms. But again, if I don't, the gremlins hop off, homeostasis is restored. But what if I do? What if instead of just one piece of chocolate, I've got a whole box of chocolates and I continue to ingest more and more dopamine over more and more chocolate over days to weeks to months to years? Those gremlins start to multiply. Pretty soon I've got enough gremlins on that pain side of the balance to fill this whole room, and they're essentially camped out there. And now I'm entering into addicted brain, right? Now I need more of my drug in more potent forms, not to feel the pleasure, but just to stop feeling the pain of being in that dopamine deficit state. And this is essentially what drives addictive behavior. It starts out as wanting or it starts out as liking pleasure, and then it just becomes pure motivation to restore a level balance. And that gets to the second rule of the balance, which is that with repeated exposure to the same or similar reinforcing substance or behavior, that initial deviation to pleasure gets weaker, we tilt less, and it gets shorter in duration, but that after response to pain gets stronger and longer, and eventually we can get stuck in that position in this kind of chronic dopamine deficit state. And that's essentially what addiction is. Now, we know that with enough brain plasticity and enough abstinence from our drug of choice, those gremlins will eventually get the memo and say, okay, it's time for us to get off so that homeostasis can be restored. We don't need to be here anymore. But it can take a very long time, depending upon that individual, how long they've been using the particular drug of choice, how old they are, other comorbidities. So that is essentially the way it works. The third rule of the balance is that the balance remembers. And once those gremlins have been created, even after they hop off, they're waiting around in the wings to hop on again. And so that means even with a very minimal exposure to our drug or a similar drug, they will immediately and in hordes hop on the pain side of the balance, which is why people will plunge back into the depths of their addiction, even with a single exposure, even when they've abstained for a long period of time.